Um, Good morning and good afternoon. Welcome to today's NTAC session entitled Minds Matter, Strategies for Supporting Students with Mental Health Challenges in Schools. We are so happy you're taking time out of your busy schedule to join us today. Before we get started, we do have a few housekeeping items to go over with you. First, we'd love to learn more about you in the chat box. If you could just take a minute to enter your organization, your role, and where you're located. As part of our session, we must provide this disclaimer. The presentation was prepared by NTAC under a cooperative agreement from SAMHSA. While this event is supported by SAMHSA, the contents are those of the authors and do not necessarily represent the official views of SAMHSA, HHS, or the U.S. government. While we hope there are not any security issues that happen today, in the event that may occur, the session will immediately end and you will be notified by email how to rejoin a new session. Thank you again for attending one of our NTAC sessions. Listed here are all of our incredible national partners that have come together to utilize their expertise and their subject matter knowledge to help inform the field by creating products, resources, and sessions like this one to enhance the behavioral and mental health fields. As a center, our vision is that all children, youth, and families living with and impacted by mental health challenges will have access to the resources and opportunities they need to thrive in a comprehensive and equitable system of care. We serve a wide cross-sector audience, including everyone from state leaders to providers to school workforce, infant and early childhood providers, community-based providers, peer supervisors, family partners, youth partners, and much more. Our services range from individual consultation to more in-depth sessions like the one we're offering today, to peer learning exchanges and tools to help you. Our aim is to really create those outlets for communication, collaboration, and resource sharing amongst all of us. Please make sure to check out all of our resources and archived presentations on our website, or go to the Contact Us link there to request consultation or training. Before we get started, we wanted to address some commonly asked questions that come up during our sessions to let you know before we get started some of the answers to these questions. In the follow-up email for today's session, you will receive a certificate of completion, a link to the recording of the session, and a copy of the slide deck presentation that is being shown. You may also have received a copy of the slide deck in the reminder email that was sent earlier today if you would like to access it for today's session. Now that we've made it through our housekeeping items, we want to welcome you again to our session today, Minds Matter, Strategies for Supporting Students with Mental Health Challenges in Schools. I am Olivia Hamra. I'm a child and adolescent psychiatrist at MedStar Georgetown University Hospital. I work with adolescents and transition age youth clinically, and then also in the MedStar Center for Wellbeing in School Environments, where I consult with schools and see students in the school environment.
Hey everyone, my name is Ariel Brooks Porter. I am a special education coordinator. I work currently with DC Prep Public Charter School, and I work with elementary age students. And I am an advocate for ensuring that students have opportunities to learn despite the conditions set against them. It's super important for us to understand how we can provide supports, tools, strategies, and skills to push students to be their best selves inside the classroom and as they matriculate into the real world. I'm super excited to have you guys here for our last session today.
Today, we're going to follow the same structure we've been following. We'll do some introductions in breakout rooms and a mood check-in. Then our topic today is trauma. It's a big topic, but we'll do our best to be brief to allow time for a case presentation and group discussion. So I want to start out by asking how is everyone feeling today? on this lovely Friday. You can choose one or more emojis that you feel represents your mood. Type it in the chat so we get a sense of where everyone's at. I need to find my emojis.
Oh no, Carrie, Alan Carey. That's about to be me soon. So I'm sending you all the shine and all the love.
Mhm.
Oh,
Oh no.
hi, bro.
Well, it's the end of the week. Hopefully that's a good thing for you.
Yeah, hopefully. Okay, so it's like a mix in between the two, is what I'm gathering, Diana.
I think it seems like I'm not the only one who's had kind of a weird week.
It really was a weird week.
Well, let's get chatting to get the energy going a little bit this morning. And we have a very, I don't know, hopefully fun, low-key icebreaker today. We're going to put you in groups of 2, and I want you to answer the question, if you could travel anywhere in the world, where would you go and why?
I don't know where I would go.
No?
I don't know. I feel like no, I don't know. Uh, could we have somebody share? If you could travel anywhere in the world, where would you go and why?
So I have 2. Jamaica, because I have one of my best friends. I like the culture. I like the food. Like, I just want to go to Jamaica. I do not like hot weather, so I don't know how that would work. And then I want to go to Japan to see the cherry blossoms.
Oh, that's a good one, Abra.
Yeah.
Mm-hmm.
And it's so beautiful. Okay. Transition into something a little heavier. Today we're going to be talking about trauma. It's something we see a lot of in schools, but sometimes it can be a little tough to put your finger on it. Like I said, there's a lot to talk about here. So we're going to be brief, but if people have questions, comments, discussion points, I invite people to chime in. There's different ways to think about trauma. I got this definition from the National Center for Traumatic Stress. When a child feels intensely threatened by an event he or she is involved in or witnesses, we can call that event a trauma. And then I have just some examples of things that we might consider to be traumatic. There's also this idea of complex trauma that I think is really important to understand. When we talk about a single trauma, that's usually a single event. But there are people who are exposed to multiple traumatic events over the course of their childhood or their lives. With complex trauma, this can be really pervasive and severe, like abuse or neglect. It's usually early in life, so it impacts development, sense of identity, the ability to form attachments to caregivers and then other people later in life. And it really impacts just like physical and mental development in general. If you haven't heard of adverse childhood experiences or ACEs, this is something that's really important to understand when you're thinking about trauma and its impact on development. The ACEs study was this groundbreaking survey that was conducted in 1995 in California by Kaiser Permanente. And essentially what they did is they asked people about a history of certain experiences from their childhood before they were 10 years old. Things like abuse, neglect, and like what things were like within the household. And what they essentially found were two like really big takeaways from the study was adverse childhood experiences are very common. And the more adverse childhood experiences you're exposed to, the higher you are at risk for a ton of negative outcomes, like impacts on your physical health, impacts on your mental health, things that people have realized like this is really important. We have to go back to childhood and see what we can do to prevent these things from impacting development. Later, like 2012, Philadelphia conducted another study looking at ACEs, but specifically community level adversity. So the original ACEs study was done in more of like a middle income, predominantly white population. And then the expanded ACEs is looking at more of a diverse urban population. So they included things like witnessing violence, feeling discriminated against, the neighborhood experience, being bullied, or having lived in foster care. And they essentially found the same things, that with the more of these adverse childhood experiences you are exposed to, the higher risk you are for many outcomes later in life that impact your physical and mental health. This bar graph is showing the impact of adverse childhood experiences on mental health conditions. So ever being diagnosed with a mental health condition. The dark blue bar is 4 or more ACEs. So what is the link between these adverse childhood experiences and these outcomes later in life? And a good way to think about it is this idea of toxic stress. So if you are exposed to chronic activation of your stress response system, it changes the way your brain and your body develop. And because of that, it puts you at risk of these outcomes later in life. So things like the emotion, the fear processing center of your brain changes. The part of your brain that's responsible for learning and memory, the hippocampus, is affected. And the prefrontal cortex, that's the part of the brain that's involved in executive functioning. And that's kind of a reason why kids with trauma and kids with ADHD can be hard to tease apart. I know we talked about that in our session on ADHD. So how do we define post-traumatic stress disorder? This is the diagnosis that we see in this DSM-5. So if a medical doctor diagnoses PTSD, then that means the child meets these criteria. So number 1, you have to have some exposure to actual or threatened death, serious injury, or sexual violence in one or more of these ways. So essentially you have to have experienced a traumatic event. And then there are 4 symptom categories that you would have to meet criteria for to be diagnosed with PTSD. The first one is intrusion. So these are symptoms of like re-experiencing the traumatic event in an intrusive way and distressing way. So this can be like intrusive memories, nightmares, flashbacks, like the dissociative reactions where you feel like you're actually back in the traumatic event. And then in children, what's really important is to know that a lot of times you might see this in their play. So like in a younger child, if you're seeing this being repeated in themes of their play, that would count as like an intrusion symptom. Then there's avoidance. So trying to avoid whatever stimuli might be associated with the event, changing the way that you're walking to school or trying to stay away from certain kinds of people or things that might remind you of a traumatic event. Negative alterations in cognition and mood. So these are like the things that then you're left without as a result of the trauma. So like not being able to remember parts of it, feeling really negatively about yourself or other people or the world around you, feeling to blame for the trauma, just being in this like persistent negative emotional state. Like it might be anger, it might be sadness, it might be guilt, not wanting to participate in activities, feelings of detachment from others, or inability to experience positive emotions. This can sometimes look like depression, but if it comes along with all of these other things, then we would say it's PTSD. Hyperarousal, this is the last symptom category. So this is like increased arousal and reactivity associated with triggers of the traumatic event. So that can look like irritable behavior and angry outbursts, reckless or self-destructive behavior, hypervigilance, an exaggerated startle response, problems with concentrating, or sleep disturbance. And this is like that real activation of the fight or flight system that becomes pretty persistent with people who have PTSD. There's another diagnosis that is not in the DSM-5. I'm hoping it's added in future versions. And it's this idea of complex PTSD. So I already introduced the idea of complex trauma. And so what complex PTSD is when someone has been exposed to that kind of complex trauma, they not only experience those symptoms of PTSD that I just described, but they also have these changes in the way that they are like experiencing themselves and forming attachments. And so that can be like a real dysregulation in affect, a negative sense of self, and then difficulty in forming and maintaining meaningful relationships. If you know about the diagnosis of borderline personality disorder, like sort of that real unstable sense of self, really unstable and insecure attachments to other people, like that's kind of what complex PTSD is. It's like a combination of PTSD and borderline personality disorder. Sure, Abra, you just raised your hand.
So you just blew my mind. So do you think if it gets added to the DSM-6, whatever, that you'll see a rise in that complex PTSD and a decrease in the borderline? Because I think you're absolutely right. Like, yeah, well, that just blew my mind.
I think that's the people who are pushing to have this diagnosis added, that's kind of the point. Yeah.
Is there a way to determine a difference? You know what I mean? Like,
it would be the presence of complex trauma.
okay. So, all right, cool. Thank you.
And then from that, Dr. Hammer, Abra, that was a great question. It just made me think about how, because when looking at the stats, when we think about trauma and ACEs, oftentimes students are misdiagnosed with ADHD. And then that makes me think about the complex PTSD and how that would create some possible confusion or a gray area between differentiating if a student does in fact have complex PTSD and or ADHD. And I wonder if they would create some criteria to distinguish the two, or if there would be some testing that's created to kind of help mitigate those gray areas.
Yeah, I think that would definitely that would have to be done. Like the criteria would have to be really carefully written.
So I have another question. So I have a current child that I think this meets it, and the therapist literally just within the last 2 months started the diagnosis of borderline. How how can I relay that information to that therapist about this?
I had put some resources in the slide deck that I think are really helpful, and they link to like useful definitions of complex trauma and complex PTSD. That might be a good place to start. Either way, like the therapy would be pretty similar. So I don't know how much that would change her treatment, but I think it would be helpful to as like an understanding of where this child might fit in terms of where they're coming from.
So the child, the young adult, she is 18 and got upset with the borderline personality, where this might be more accepting for that person.
Yes, I actually do. A lot of times I will introduce this concept when I'm giving people a diagnosis of PTSD and borderline personality disorder, because I do think it kind of makes more sense.
And
Yeah.
then I have one more question. I wonder if then in that moment, does the timing matter? You know how oftentimes when it comes to students with learning disabilities, you're kind of like, okay, from ages 3 to 7, as they develop a little more, and then we test them again. Would that be the same when it comes to students who have trauma and BPI or BPD?
Yes. Yeah. I mean, one of the beautiful things about trauma and borderline personality disorders, they're very treatable. And if with the right treatment and the right supports, people do very well. And a lot of times borderline personality disorder is you don't have any symptoms of it after appropriate treatment. It's a very treatable. I remember learning like people who work in borderline personality disorder will call it like a good news diagnosis, because there's really good evidence-based treatments for it. There are a lot of screeners for trauma. This is just one that I like to use. You can use it as a self-report tool for older kids or an interview. And then there's also a caregiver report that you can use also for like the really young kids. These are just like short clips that I took. There's more questions than this, but it asks about exposure to traumatic events and then also symptoms associated with the trauma. So I think it's pretty useful. And then treatment for trauma. There's no medication that treats PTSD like alone, but therapy is very helpful. Trauma-focused CBT, EMDR, dialectical behavioral therapies. These are all really good evidence-based therapies for PTSD. Medication can sometimes be useful, particularly, and I've used this a lot in the schools, and our Ariel knows this, medications like guanfacine or clonidine are medications that kind of suppress that like hyperarousal, hyperreactivity, fight or flight response. Those can be used in an evidence-based way for when kids are having like aggression or outbursts related to PTSD. And then for things like insomnia, nightmares, and like sleep disturbances, prazosin is another medication that can be really helpful. If there's comorbid anxiety or depression, then you can use an SSRI. That would be like Zoloft or Lexapro or Prozac. But SSRIs, really, there's no evidence that they treat symptoms of PTSD in children. They do in adults, but not in children. All right, I'm going to pass things over to Ariel.
Awesome. Thank you, Dr. Hammer. Awesome. Before we go ahead and jump into the things that we want to see in the classroom and ways that we could support students, I just want to take a moment for us to take some time to actually look at some of these statistics for children, adolescents, and how they are experiencing adverse childhood experiences. And in looking at these statistics, I want us to think about how we have grown and matriculated through life, but have also experienced these same adverse childhood experiences. The reality is, when experiencing these things in life, they impact students in the classroom, they impact their ability to do work, to focus, to self-regulate, because they are consistently in survival mode. Oftentimes, are often in survival mode. And so I kind of want us to go into a lens of where we as the educators can step back and provide some grace in thinking about the things that our students are experiencing on a day-to-day basis. I'm gonna give us a quick second to look at these stats, and then we're gonna jump right in. All right, awesome. Now we're going to jump into what we might see in the classroom as a result of experiencing some adverse childhood experiences, as a result of having some trauma inside the home. Sometimes this looks like a student being anxious, having fear or worry when they come to school. Sometimes that worry could be like, oh my gosh, I'm about to be away from my mom. I have this attachment. I don't know if they're going to come back at the end of the day to pick me up. Oftentimes it's crying, feelings of guilt, shame, and self-blame. Some things are happening because they feel like it's their fault. They could have fixed it and done something differently. Headaches and stomach aches. Oftentimes it could be when they get to school, or they're triggered and they're thinking about something that they experienced at home that forces them to get some of those symptoms: nightmares, disrupted sleep. So they're coming to school super tired because they couldn't sleep at home. Angry outbursts and aggression, some withdrawal from the class, more one-on-one time. They're not engaging and being a part of the group. Over or underreactions to specific situations in the school environment. And this also looks like concerns about how other people are perceiving them, how other people feel about the things that they do, the things that they say, and the way that they show up. Withdrawal from their family, avoiding reminders of the event. So similar to what Dr. Hammer shared earlier, that's one of the symptoms, that avoidance of certain spaces, certain things, certain people. More intense mood swings. And sometimes it seems like it's coming out of nowhere. However, it is triggered by something a student may have been reminded of from the experience that they have had at home. A decline in school performance. Oftentimes we see this, students are doing really well. And then all of a sudden their grades begin to slowly drop. They're withdrawing from the classroom, and we're unsure why. And then increase in some risk-taking behaviors, trying to do more things, acting out in the classroom, eloping from the classroom, a number of those things, fights, self-harm, etc. I want to take some time to move into a quote that I seen yesterday when I was doing some research, just in regard to trauma and what this looks like for our kids in our classrooms and in our schools. Can I have someone come off mute and read the quote for the scene? Yes, so living in a constant fear, activated state of hyper awareness means that these students can be quick to rage. They can be perceived as defiant, disrespectful, or overly aggressive, explains Illinois special education teacher Kathy Ritchie. Others may look like they're zoning out of drifting off, she says, or it can look like kids are shutting down, but their brain is telling them that they need to be safe. So oftentimes, kids are trying to do what they think is going to keep them safe, inside of our school environments, even though it may look like defiance or it may look like they're acting out. And that's where that grace comes in on our end, because we have to try to understand the full picture. Not to say that the behavior that is showing up is okay. However, we have to be able to provide our students tools so that they are self-regulating and using some replacement behavior so that they are not triggered and they're not impacting their school environment in negative ways. So what can educators do to help? First and foremost, one thing that's super important is that while students experience a lot of these things, we need to think about how important our learning environment is and understanding that it matters. So when we create a safe learning environment for kids, it provides a sense of calmness and it provides a sense of comfortability. Some of those strategies that we want to use are like, what are some calming colors we could use? Those blues. How do we use some sensory tools and strategies that help build that self-regulation? So we see a lot of fidgets, and I have some teachers that are like, I don't want to fidget in my classroom. And then there are other teachers who definitely understand the use of one and why we need them for our kids. So how are we teaching students how to use tools like fidgets, like stress balls, to best regulate their emotions and control their actions when they are beginning to get a bit dysregulated? We can also include some mindfulness strategies inside the classroom. Some schools call it a mindful moment, where you just take some time to do some deep breathing, some reflection on the moment, an opportunity to step outside of the current space that you're in. Thinking about how we're redirecting kids. So instead of doing a whole group call out, we're thinking about, am I passing a note to the student? Am I pulling them aside? Am I using some more nonverbal cues to redirect them opposed to re-escalate them? And then ultimately the use of social emotional learning lessons. A lot of schools are trying to move towards some more trauma-informed teaching with social emotional learning lessons. And the caveat to that is, while we teach the lesson, it's important to be able to thread it throughout the entire day, so students are having opportunities and at that to try those strategies and skills in the classroom. All right, the next thing is leaning on the community. So yes, we are building our learning environment, but we're also leaning on the community. We understand that students experience trauma, and we are not all counselors. We are not all the trauma professionals that could best support a student, and we recognize that. And so leaning on the community is important because it'll provide a student support throughout the school team, and it'll allow them to openly express their needs and get the support they need in a more secure and vulnerable way. And so creating opportunities to work with school counselors and support personnel to unpack trauma needs. I know the school that I support now has, we work with the WISE clinician, we work with a couple community partnerships to provide students and families resources so that they could work through these specific needs. And including the family team so that everybody's aligned on the support that we're putting in place to support kids. Sometimes this works, right? Because we want everybody to be on the same page. And then other times the family is what's triggering and impacting the trauma that a student is experiencing. So we need to be able to lean on our community to ensure that we are putting the best supports in place to push our kids forward. There are a couple things and strategies that I want to share with you guys as well. Some that show some preventative measures, in the moment measures, and then after the moment measures. First, we're going to look at the preventative strategies. First, like I shared earlier, the learning environment matters. So we have some safe and predictable environment strategies that are necessary. So creating that warming classroom, having expectations, the routines, and this is something that's been consistent across all 4 sessions. Being able to have a consistent routine for kids is a game changer, because then they know what to expect and can kind of control their day just a little more, or at least feel like they can. Having their schedule, preparing for transitions, and then communicating how to be safe. We also have some relationship building. So talking to them about their hobbies and interests, and really creating an environment in which students can trust and feel safe within your care and within your classroom environment. And then we get to self-regulation when we're thinking about what are some coping skills, some strategies and activities that we put into place so students can actually regulate themselves. That mindful moment. At my school right now, we're using a lot of like zones of regulation. What does that look like? How can students identify that they're in the red zone and then choose a strategy that helps them to calm down? Sometimes this looks like a calm down space. It might be in the corner of your classroom or your office, or it could be a room inside the building. And then overall, we're modeling these skills. Just as students are experiencing life and traumas, we do as adults, and it's important for us to be able to model what that should look like in the school environment. The next thing I want to think about is some of these in the moment strategies. We know that we can't prevent everything, and sometimes some traumatic responses show up throughout the day and in the moment, and we need to be able to respond to our students, not only to keep the one impacted safe, but the ones around safe as well. The first one we want to look at is, again, that safe and predictable environment. Make sure you're aware of the students' body language. How are they showing up? And how is this directly impacting the entire class? Sometimes students may go into crisis inside the classroom, and we have to be steadfast and think about, okay, let me evacuate my class away from the student until the student can get some more support. In other terms, it may just be that I'm alerting my leadership team, my school team, so that they could come in, pull the student and support them in a way that allows them to be able to discuss their feelings and re-regulate. Again, relationship building is super important. When we have strong relationships from the beginning, we can leverage those in the moment to help calm a student down quicker than we would if the relationship was not one that was positive. And that's why when we think about like how we're redirecting kids, yes, co-regulation. When we think about how we're redirecting kids, we want to make sure that we're doing it in a way that allows them to feel comfortable with us. We are doing those private redirections, having a conversation with them, some restorative conversations that allow them to understand that we are here, we're in their corner, and we want to see them succeed at all times. Self-regulation again, and I really love that Alan put co-regulation, because that's a perfect way to be able to model what it is we want students to see. And also, like, when a student has traumatic experiences in our spaces, that can be traumatic for us too. So we want to be able to co-regulate and show them, you know, hey, we're all feeling this way. Let's take some time and come back down. When a student is in crisis, we don't want to engage in power struggles. If you told the student that you wanted them to sit down at their desk and they're like, I'm going to stand up, but the goal is that they need to do their work, sitting down and standing up is not the battle you want to fight, right? You want to think about how our voices are. Are we having emotional constancy and keeping our kids calm in the spaces that they're in? And then always know that you can tap out, pull some leadership personnel, a counselor, someone else to come into the space to support you and the student to get back to baseline levels. And then lastly, we want to think about, how do we show up for kids? What are those strategies that we want to implement after the moment, after a student was dysregulated or had a trigger inside the classroom? What does that look like? And so some of those after the moment strategies on the next slide are that we're providing students with a safe place to talk about what happened. Okay, we're engaging in a discussion that includes some positive praise. Thank you for calming down, cleaning up the room, coming to have this conversation with me. All of these are hard things for kids to be able to like just jump back and do. We want to praise them for doing the things that they can. Provide them with some appropriate responses to strategies for if a situation like that comes up again. Allow them to be able to process what that should look like and pick how they're going to respond if they encounter a similar situation, because 9 times out of 10 they will. And then we want to be able to include some potential consequences for the behavior that they exhibited, and ensuring that a student is comprehending that the behavior they exhibited is the direct correlation to the consequence that they are receiving. Because ultimately, that's what it is. And when students can understand that through line, then they're able to receive it in a better sense. And then ultimately providing them steps in which they should take when they're resuming back to the classroom environment. Does anyone have any questions about those three types of strategies? I kind of went pretty quick, but I want to give us some time to jump into the case study as well. Perfect. Okay, we're going to take some time now, and we're going to jump into a case study similarly to what we have been doing for the past few sessions. Before we start, I would like to see, does anyone have a case that they would like to present to the group today?
What kind of case are you looking for?
We're looking for a case for students that you're experiencing in your practice, who could possibly be experiencing trauma right now, and you're looking for strategies from the group to share with you to support, build that student up, and mitigate some of those trauma experiences that they're having inside the school.
Sure. I can give one.
Awesome. Thank you.
I have about 10 kids that went through my brain. This is one I feel like could use some classroom strategies because there's not a lot of outside supports already in place. But fourth grade, female student, some housing transitions for the family, over the years. And we're seeing an increase in what teachers perceive as defiant behaviors, head down, hood, going up over the head, especially during non-preferred tasks. And then kind of more explosive, like verbal reactions when she is redirected by teachers or staff.
Mm-hmm.
No other sort of explicit trauma, but lots of those trauma reactions that seem consistent.
Okay, so we have she's a fourth grade student with some housing transitions right now, exhibiting some quote unquote defiant behaviors, such as like having her head down, put on during those non-preferred tasks, explosive behaviors when she's redirected in the class. Does anybody have any questions to ask Alan based on the case study that she just presented of a student that she works with? I want to know what the relationship with the family is, with the school or the teacher. How is that connection?
It's inconsistent. There was not a lot of rapport, I think, with the school and the family earlier on in the year. The relationship at this point is very it is discussions around what student behavior is looking like. So the family seeking information from the teacher periodically about like, how does that look? So in some ways, I think that has actually exacerbated some of the student behaviors because she's seeing the school connecting with home as that she's getting into more trouble at home, I think.
One of the first things I think about is how we push the teachers that work with her most to kind of change that and kind of push more of the positive with the family team to get them a little more invested in supporting the student when she is exhibiting some of those bigger behaviors.
What about how is the student in terms of being able to self-reflect or, you know, connect some of the things she's been experiencing to the behaviors?
So that's some of the work that I'm doing with her. And there is a good amount of insight kind of after the fact. It's in the moment, you know, that she sort of has this internal, very negative dialogue going on. And so really trying to get to some of those mindfulness techniques to try and help her in the moment, give her brain a moment to think through what her best options are, as opposed to those automatic responses.
Diana just shared a good comment in the chat. She said, to me, not having stable housing, it's so disruptive in family life, as well as probably manifested in how she interacts in her school life. But we tried to make her feel the stability in school that was lacking at her home life. I think that's also something that could be implemented in the classroom environment and in the school environment. Having like a transition plan in the morning, somebody meets her regularly, maybe has breakfast with her to continue to build that student-teacher rapport, and having it consistent so that she already knows what to expect, especially since like when she goes home, she probably doesn't have control over knowing what to expect, especially with the transitions. At least she has some place where she can kind of feel a sense of calmness and safeness.
Yeah, I definitely think like having a morning check-in like that creates this like stable routine and also transition to school from like maybe a chaotic home to like hopefully a more stable school environment, or that's potentially more predictable, and to check in and say like, where are you at right now? So that then you can also prepare if she's saying like, I didn't sleep last night, or I didn't have a good night, and I'm like, or I'm not feeling good today, then you can kind of work through like, okay, what is that going to look like in your day to day?
In my experience, it also helps to build the relationship with the family, because it's kind of like that handoff in the morning. They're bringing the kid to school, you kind of meet at the door, you touch base with the family as well, and it kind of like begins to blossom into kind of like a better relationship. It allows them to feel comfortable to say, hey, X, Y, and Z did or didn't happen last night, and then the student can fill you in more.
Ariel, I don't know if it's just for me, but your volume seems to just be getting further and further away.
Oh no.
Yeah, it's a little bit quiet. I can still hear you, but I agree, it's a little bit muffled.
Okay, how about now?
I think it's okay. I'm also wondering for this student, what was I gonna say? How are the behaviors being managed now in the classroom? Like when it happens, what is the response? Oh, you're on mute.
That's really what I would love some suggestions on. You know, I don't have a lot of say in how that is managed in the classrooms. I do think the teachers have hit a point where there's not a lot of patience. And so figuring out how to help the teachers use some of those co-regulation skills, them staying calm, staying patient, to be able to see some of those improvements in the behavior within the classroom. And I think we see that a lot, especially at the end of the school year, when there's a lot of, testing pressures or there's a lot of disruptions. I think the last month of schools, there's changes in routine. So there's an increase in student behavior and a decrease in teacher capacity, I feel like.
Yeah, I agree with you. That definitely happens a lot. It's just kind of like, okay, the year's over. And I think we all kind of see toward the end of the year, it's starting to get warm outside. Kids are excited. We want to go and come to school and have a party every day. And I think that's the time where we really have to beef up previewing things for kids. Tomorrow, this is what we're going to do, providing them an opportunity to see the schedule. Maybe they're coming in and receiving their own schedule, especially for students who are often dysregulated, giving them an opportunity to be able to say, okay, at 10 o'clock, we're going to do this. Early in the morning allows them a sense of calmness in that consistency. That question that you just asked, Dr. Hammer, it made me think I wonder if there are any tiered plans in place, a tier 1, plan or incentive plan to support her so that she kind of feels okay, I want to get this positive thing, so I'm going to follow the expectations or try to use some of these self-regulation skills to mitigate when I'm feeling frustrated and upset.
And that is a good question those are the notes that I just wrote down, going back to see with our multi-tiered system coordinator, where is she on those tiered supports? Check in, check out is one of those sort of designated interventions for a certain level. Is that something that we can make sure is in place for her? And if it is currently in place, what does that look like?
Mm-hmm.
The other thing I think about a lot with trauma is that when people experience trauma, it's this really, really intense feeling of being out of control. And the more you can develop a sense of choice and control in the students, I think the better they will do. So even working collaboratively with her on those plans, and what she thinks would be best if this is a student who's who can be pretty reflective, could be really helpful. So she knows that she kind of has a say in how things are managed, and what she wants to do to help her calm down, giving her the ability to take breaks if she's really feeling worked up or needs to, leave the classroom, can be helpful.
Right.
Right.
The opportunities for forced choice, because then it's she's making the decisions. You can do X, Y, and Z, and then it's you're really in control when it's really you're just doing one of the things that I want you to do anyways.
Would you like to do this or this?
Yeah.
Definitely. The other thing I also like to say for people who are working with kids who have trauma is even one positive adult relationship for a child with trauma is a protective factor against these negative outcomes of traumatic stress and toxic stress. And you are all adults that are working in these kids' lives. And I hope that empowers you to just form these really positive relationships with these kids, because in doing that, you're protecting them, and their futures. And so I hope that's empowering too. We are at the end of our time. Oh my gosh, it's already 1 o'clock. So I'm going to quickly go through the closeout slides.
And I'll drop the survey in the chat.
Thank you. So there's a survey we're putting in the chat. If we do run a learning community like this again, it's really helpful to get that feedback. If there's other topics that we haven't covered over the past few sessions that you think would be really helpful, let us know. And we can certainly bring this back and do other topics. Thank you all for joining us today. Really appreciate everyone's participation. Alan, thank you so much for presenting a case. It's really good to get those real world examples, and hopefully it was helpful for you. We will be typing up some of the case and some of the recommendations and the resources that we presented, and now you all will get a copy of that after the presentation. If you missed the beginning of the session, I want to remind you again that to be on the lookout for a follow-up email. Again, you'll get those case notes, but you'll also receive a certificate of completion, a link to the recording of the webinar, and a copy of the slide deck. There will also be another survey from NTAC. That's an important part of NTAC's quality control and the future funding of this project, as it allows us to continue to provide you with resources and training at no cost. In addition, it allows us to continually improve our services and provide the information and resources you are needing in the field. So take a few minutes to let us know your thoughts on that survey as well. And then here is our website. You can see on the website some upcoming events, any archived recordings. You can request individual support. We also have publications and resources, and you can sign up for our newsletter or also follow us on social media. And then here's our contact information and our website. And finally, I'll just close with SAMHSA's mission is to reduce the impact of substance abuse and mental illness on America's communities. So thank you all for joining us today. It's been a really nice month of sessions with you all, and hopefully it was useful.
Yes, I hope you guys enjoyed our sessions, and thank you so much for joining us all month.
All right, have a wonderful weekend.